Hello there, I'm Jayvent, consultant, vascular surgeon, and got Lalit Jayashekhara, consultant, anesthetic colleague here. We just want to talk to you regarding the ventilator training which we have been running for the last 1 week or so for the doctors and the nurses. Obviously, this is in preparation for the wave for the COVID pandemic, which we are expecting to hit us anytime now. When you're coming to see a patient who's on a ventilator, we would expect you to be having personal protective equipment and the guidance on the PPE, which is available in the hub on donning and doffing. There are separate videos which we have already put up on the hub, and you will be able to access it. This is when you have got a patient who's actually on a ventilator. We want you to be aware as to what you should be looking for to make sure that, one, you are safe, and two, that the patient you're looking for is also safe. So Lalit here would be able to take you through the basics of what you would be expected to know when the patient is on a ventilator.
Hi, I'm Lalit. I'm going to show you about the ventilator screen. So when you come prepared with your patient is already on the ventilator, so there are two screens here. This screen is the ventilator setting screen, and this is your monitor where you have you all know about ECG, saturation, blood pressure. There are additional measuring parameters I will explain to you. So I'm going to focus first on the ventilator setting. On this dial, on this side, there are three buttons. They are blue color buttons. On this corner, it gives the level of oxygen. That's 100. At the moment, I have set it for 100%. So when you come, it could be sometimes patient could be on 75% or 65%. Next to that is the flow rate, which you don't have to change. Next to that is the brown color buttons. There are 1, 2, 3, 4 buttons, and there's another button saying ventilator setup. As a non-intensive care doctor, you don't have to do any of these changes, but you have to get an idea of the settings. So this patient is being set up for tidal volume for 500, and patient is breathing 12 breaths per minute. And there's another setting called PEEP. So these setting changes will be done by the intensive care specialist, anesthetist.
Lalit, when I'm here to look after this patient, you would not expect me to be doing anything on the dials. If I'm in doubt that the patient is not doing well, I would be calling for help and getting you to come and do what is needed.
Yeah. Now, once the patient on the breathing machine, so you can hear some alarms coming up. I will explain them. There are two waves running along. Now you don't have to know exactly what they are saying. The numbers, what you are important is on this column here. This number here gives you the respiratory rate of the patient who has been set up, and I won't say more than that on these settings. So when you come to see the patient will be connected to this breathing circuit. You will see few components. We call it the catheter mount. and it's a closed circuit, so it's not open to the atmosphere. This tubing is for the suctioning purpose, so it's all sealed.
So does that mean that even if the patient is COVID positive, I'm not going to be exposed to?
You won't be exposed. Yeah. So if you see a lot of secretions, most of the time the nurse will be doing this. But if the nurse is busy, when you're wearing the protected gowns, protected material, you can help with the suctioning by pushing it in and pressing on this button.
So again, when you're doing that, there's no risk of
there's no risk of infection. It's a closed circuit. So and there's a filter here, and the filter is connected to the breathing circuit with got an inspiratory and expiratory limb, and there's another connection here to measure your carbon dioxide coming out from your breath.
So that is the one which shows the carbon dioxide trace, and that's what we are looking to see whether there's a problem with the breathing.
So when you come, this tubing should be clear. So if you see a lot of secretions in the tubing or secretions around in the filter, that means the filter needs changing.
Obviously, that's something which we would expect the IQ trained nurses and doctors to do. We will not be expected to do that.
Yes. So I will show you about the tracing, which is important to understand. We call it end-tidal carbon dioxide tracing. If you can screen here. Are you showing this tracing now? Okay, you can see the tracing now. So these are numbers on this side. That's 4.4 is my carbon dioxide level is coming out. So you should see a proper waveform. If the patient get disconnected from the breathing ventilator, the tracing will become more flat, and there will be an alarm coming up. So that is one indication there is an issue with the ventilator.
And you call for help.
You call for help. So you can see it going 0, and you can focus on this as well. These two lines will go flat as well.
Essentially, if there's a problem that the alarms are going off, you need to be asking for help from the ITU nurses and from the ITU doctors.
What is most important thing is not to get panic. So there will be more trained people around. What you need to do is escalating to the next level of expertise. So this is the cardiac or the monitor of the patient. So there will be a ECG trace, and the next yellow color tracing will be your saturation, 97% or whatever the patient's saturation, and there you get the heart rate of the patient. So if there's a disconnection, as this line shows, the saturation will start coming down. So that is the moment that you have to take action and ask for senior advice. When you see the issue with the ventilation, you have to start from approach to learn approach to check from the patient whether there's any disconnection of this tubing, whether there's be any fluid collection in the filter, and then go along the tubing whether there's any disconnection on this tubing, and whether we are delivering the oxygen to the patient.
Because the oxygen is coming through pipe system here, and so there's unlikely to be any problem related to the oxygen cylinder going off or anything. We are running the ventilators on a pipe system.
Yes. So most of the time you are supposed to recognize any obvious fault. The rest will be dealt by the help around you with the senior help.
And each time when you're coming on to help us out and you're doing a shift, we will make sure that there are people who are around to make sure that the patient is actually adequately ventilated and on the correct ventilator setting. Do we need to know anything about the soda alignment? All that?
No. Normally, this circuit has got a canister called carbon dioxide absorber, which absorbs the carbon dioxide coming out of your breath and it recirculates the rest of the gases into the patient. So it's basically that's why we call it a closed circuit, where we can conserve amount of oxygen and we can protect the environment as well. So this canister needs some stage, it will need changing, but that is also will be helped by the senior help in the unit when you come to see the patient. You don't have to personally change the canister. There will be a senior ODP theatre practitioner to help us.
We are all here to help our patients, and you need to be assured that we will not be putting your lives at risk by your volunteering to come and help us. There are lots of information which you would be looking for. It is available on the internet, on the hub, and I'm sure every day when we coming on the shift, we learn and we'll be able to give the support and help which you guys need.
Yes. If I summarize, most important is when you come for the shift, get familiarized with the patients, how much oxygen patient is on, any issues with the ventilation. So you will in advance, if you know, if the nurse says there are some changes, so you can act on that. And most importantly, not to get panic and to go by system. I told you can check from the mouth, the connection, going back to the breathing machine and see whether there's any obvious fault.
Thanks, Lalit. That's very useful, and I'm sure every day when we are volunteering to help, we will have the intensivists coming and doing the rounds with us and making sure that our patients are safe. Thank you.